welcome everyone to this Radar Healthcare webinar on how best to use data and intelligence to drive improvements in outcomes for patients and residents. I am Gillian Leng and I am a non-executive director at Radar Healthcare. I'm also the president-elect at the Royal Society of Medicine, and I spent over 20 years working on the board of NICE, the National Institute for Health and Care Excellence. And that role at NICE made me very aware of the challenges of safety management and quality improvement across the health and social care sector. And I used to often reiterate the old saying, you can't manage it if you don't measure it. And I think it's absolutely true. For a while, I was responsible for the national audit programs, but even when they moved elsewhere, I saw them as a really important way to drive improvement. And so some of them have been extremely effective. But of course, the future really has to be routinely collected electronic data that is easily displayed, that's easy to interpret, and easy to demonstrate improvements and flag up risk, of course. Which brings us back to Radar Healthcare and why we're here today. I'm delighted to be chairing this session. We've got a couple of great speakers to kick it off, and then that will be followed by a Q&A. You'll need to put your Q&A into the Q&A function on Teams, which I'm sure we're all familiar with now. And you can do that, of course, at any point, and I'll pick them up after we've heard from the speakers. So I'm delighted to introduce the first speaker, who's Rhian Bulmer, the Chief Partnerships Officer at Radar Healthcare. And Rhian has worked in health and social care for over 25 years. She's got lots of experience and she's passionate about the role that data and technology can have in transformation. So over to you, Rhian.
Hi, well, afternoon, everybody. Lovely to see everyone here today. My background's been around looking at how operationalising data can best serve frontline users and best serve and improve outcomes and patient safety. So we've got lots to talk about today and we're really interested to get the questions and have the interactive part at the end. So thanks, Jill. So just to give you a bit of background to Radar and where we are and why we're placed here today. We've over 260 customers. We're right across the globe now with 100 employees, and we cover all elements of health and social care. And we started life as a suite of compliance tools, and we've grown to have this total quality, safety and compliance toolkit that has this analytics overarching all elements of safety, quality and compliance, so that you can get these complete views of where your risk is, how quickly you're acting on your risk, and ultimately the things that you're doing to improve and improve outcomes. So we're really, really proud as Radar Healthcare to be able to keep doing that. But this is all about making sure that we've got data appropriate for what the individual organisations and individual teams need. So we're interested to talk through that today and show you some really good examples. Next slide. Just to give some background, I think some of our customers are on the call today and some of you from these organisations might be here, but we have a huge breadth of organisations, and we started life with smaller care groups, and we now have big care groups. HC1's the biggest care group in Europe, I believe. We've got Mersey Care, which is the biggest community and mental health service in the UK. With prison services, Guy's and St Thomas, one of the biggest acute trusts. We have this whole wealth of experience across health and social care in the UK, but not just the UK, we also international, and we've done some things which we'll talk about a bit further on in the presentation, where we reverse engineer and reverse innovate. So we've taken some of our technologies and looked at them in the Emirates and in Qatar to be able to look at how we start to prove out looking at data across the whole healthcare economy, which I'll come on to, but it's really exciting to be able to take that best practice from what happens over here in the UK and then what's happening internationally. So for our customers, you may have seen the wireframe. If we have potential customers on the call, you may also have seen that as part of your sales demos. But this is the kind of the best way we could articulate radar on a page to be able to explain all the different elements of the radar system and how it all pins together. So I just want to take a couple of minutes to go through that with you now, because it really underpins everything that we do and underpins everything that we do with data in radar. So as I mentioned, we started life as a suite of compliance tools, and that was originally in care, but right across health and social care. And it was looking at the real compliance of your systems, you know, your workforce compliance, your training documentation, your safety checks, your document management policies and procedures. And as that kind of morphed and pulled together, we started to build in a suite of activity tools, which is probably one of the things we're best known for at the moment, which is around having incident management, claims management. You can put complaints on radar, your excellence reports, feedback. We have freedom to speak up events. We've got a whole myriad of different event types that sit within the radar system. Now, these events are individually designed. The forms are bespoke to the different organisations. We have kind of standard best practice, but then that localisation for your different organisations. And all of the events are linked to our workflow engine, which is the real jewel in our crown, in that any business process linked to a certain event type, we can build that process in our workflow engine so it automates it. And that's why a lot of people come and use Radar to be able to do that, because any kind of form that you have in your system that you want to apply a workflow process with, you can do that within the system. So as we'd started to grow from having the compliance toolkits, having the activity tools, we started to look at actually the next thing you need, and the most important thing actually, is your QA and your quality assurance. So we have audits modules, tasks, notification, a full action planning suite, and all of the elements that start to form that quality assurance. So you can see everything from one just kind of very first level being compliant, to then monitoring what's happening, to then having that quality assurance to prevent future instances happening and close off the loop and have the lessons learned. So those are the three real key pillars of the Radar system, underpinned by our system tools, where we have Audit Builder, Schedule Builder. I'm going to come back and talk about Analytics Builder shortly in a bit more depth, User Manager, Form Builder, and our Query Builder or Report Builder. The beauty of that then, and my role here today on this webinar, is to talk about how all of that can build into the analytics dashboards through either the standard dashboards that you may have or custom built dashboards that you may choose to have. And this ability to look at this data across all these different elements and pull it together, not just across organisations, but into certain locations, but also across services and even across healthcare economies, really starts to be able to do something powerful with all these different data sets. I'm sure you all know, you know, within health and social care, we're actually really, really good at collecting data. And I'd say, you know, the data warehouses that must exist out there and all the different data sets that exist are vast and probably of very high quality. The bit I think that's the key for us is how we start bringing that to life and start exposing the data and doing something with it to improve outcomes. So we have these three pillars. We've got the analytics data that the analytics modules that we're able to pull that data to life. We then invested very heavily over the last year, 18 months in our API adapter. So we now have the ability to bring data sets in from external systems to Radar. So when I mentioned the reverse innovation, we did this originally in the Emirates with Cerner, whereby we took adverse events from a Cerner system and it automatically linked via an API into an incident form in Radar that then auto-triggered the correct workflow engine, the relevant workflow engine, and set off that business process automatically within the Radar system. The other part of that API means that we have a bidirectional data feed. So some of you may do this already, but actually you can take data straight out of your Radar system into your own BI warehouses. But what we can do now as part of this API adapter is bring data back into Radar, into the analytics view. And again, we'll give some examples further into the webinar of how you can start to bring data, third-party data, into that view. So you can look at your compliance, you can look at your activities, you can look at your audits, but then you can also look at third-party data sets within Radar, such as your agency usage or your staff health and well-being, or whatever those different data sets might be. We can start start to pull that together to get this complete view of what's going on across all elements and all elements that feed into safety and quality in an organisation. Next slide, Liv. So to place that, when we talk about reverse innovation and how things can be used, within the UK, we represent all elements of health and social care. We have primary care providers, ambulance services, acute trust, mental health, community, all the different elements that you would expect in health and social care. But the real beauty of Radar is we can pull all of those different pieces together and we can start to have this view across the whole healthcare economy. Now, within the UK at the moment, there's discussions around that. The use cases and the kind of reality of it require a lot of stakeholder engagement. So we used and proved out the model in territories such as the Emirates and Qatar, where they have a very different and much more directorial approach to be able to show that this data can be exposed and available across an entire healthcare economy. And again, we'll give a couple of examples of that later on. Next slide, Liv. So I think, Jill, we're going to pass to one of the other speakers now.
Thanks very much. That's a great bit of seeing the setting, Rhian, so that we've all got a good understanding of the flexibility of what Radar Healthcare can offer. So now I'm going to turn to Andy Baumann as the second speaker. Andy is the clinical audit lead at St. Barnabas Hospices. And Andy, I think you're going to talk about your work in ensuring digital healthcare platforms are easy to use, that they're user-friendly, and talk a bit about the data partnership that you've set up with Radar. So over to you.
Thank you very much. Afternoon, everybody. So yeah, just to set a bit of the scene. So we've been working with Radar since late 2022, and one of the primary reasons we went with Radar was the access to powerful analytics, on top of the ability to create a really customized and simple approach to collecting our event data and our compliance data. So we were using a system that wasn't really working for us. So one of our key focuses was finding something that works well for us from an analytics point of view, and feedback from our teams from the systems that we were using at that time was difficulty getting information into the system, not just out of the system, and quality data out of the system. So the ability to customize Radar and use it in a slightly different approach, using external forms and ease of access, using QR codes and a digital approach for our community teams, meant that we could get data into the system or information into the system very, very quickly and very easily, meaning that then we can use the power of analytics to then analyze that data at the other end. So we took a key focus on the first year to embed our event management, so our incidents and our complaints and concerns and our plaudits, essentially. So that was our key focus for the first year. So we're coming out the end of, well, we've just come out the end of that now, and we've been working through now refining our analytics and our dashboards for those, and that's been going incredibly well. So the simple approach to getting that information in obviously means that we have a really vast amount of data to review in our dashboard area. So working with Damian and the team, we've been working on our custom dashboards to develop board level and corporate level reporting that we embed into our reports across all of our committees and up to the board. And then we also use them at local team levels, where the teams meet in huddles and we present and review that data on a sort of more granular level for them to be able to understand what's happening in their teams with their patients. And we have 2 inpatient units, one at our children's hospice and one here at our adults hospice. And the teams use those obviously to review the incidents and events that happen within those units, and find it really beneficial to see that whole journey of the information going into the system, so the managers can talk through the actions that come out of those incidents and how we can work with staff and patients to improve that patient safety and care. So we have worked very hard with the project teams at Radar to build our custom dashboards. We're lucky enough to have the ability to start trialing out the new custom builds. So pulling through some of that work in Form Builder and things like that. That means that we don't have to go to Radar to ask for that work to be done. We're able to start building that in ourselves and creating a really important set of data and dashboard for us. So any questions we build into our forms, that can then automatically pull straight through into our analytics. So any questioning that we're building in, we're always looking at it of what report it can pull into and what information can that give us at the end of the journey. It's been a really simple and easy process, and lots of multidisciplinary teams being involved in building some of not only the dashboards and the outcomes of the data, but using our staff to inform our journey all the way through the build. So we make sure that we get the right data at the end of that journey. I don't know if anybody has any questions about how we've approached things, because it is slightly different to how Radar is used. We don't have end user logins. Most of our logins are for managers only. So we have a lot of managers doing the reviewing and the insight into the incidents and the data. So it is a different approach to how it's used possibly by other customers. So it's trying to minimize that need on having staff needing to, I know there is single sign-on, but we have a lot of staff that forget passwords or can't get into things. So it's trying to eliminate that approach.
This is an example of a custom built dashboard that we use in a use case of a maternity dashboard. Now, the reason that we chose maternity, again, going back to that kind of view across a healthcare economy, is maternity, all pathways obviously follow the patient or resident, but maternity has that kind of touch point across a lot of different services within a healthcare economy. So we chose maternity to be able to demonstrate the way in which that you can start to look at data in this kind of different way. So people will always ask, what's the difference between standard dashboards and custom built dashboards? And it's relatively simple in that you have a suite of dashboards within your Radar system that we build and we pre-build for you, and within those dashboards you're able to slice the data, view the data in different ways. You can export it, you can link it to your BI warehouse, all the things that you'd expect to do. The limiter is that it is based upon Radar's kind of view of the standard presets that you'd want to see, such as an incident dashboard or a falls dashboard, for example. With the custom dashboard, you're able to build and design your own dashboards based upon the different kinds of themes you might want to see. You can build commissioner dashboards, you could build CQC or regulator dashboards, you could build dashboards based on your own strategic objectives within an organisation. You can have all these different views that you'd want to build. You can also build in custom data, so you can link your custom elements of your data where you've designed very bespoke forms. You can pull that through into the dashboards through something that we call a custom cube, which I'll come on to at the end. And you can also do things where you can use kind of widgets, and Damian will be able to explain much more about this than me because it's a bit more technical, but you can use widgets to pull infographics and things in from other systems. So the way that you can visualize the data is much richer and more in depth. And finally, you're able to bring third party back into Radar, and not just take it out of Radar, but bring it back in to be able to triangulate the different data sources. So if I show you, just quickly walk you through this maternity dashboard, we've set it up, and it's just demo and it's demo data, but we've set it up where, first of all, you've got these views at the top where you can look across different locations. So you can show and design the architecture of your system up front as part of your Radar build, or if it's part of a certain area you work in, you might want to set that up by regions, by groups of homes, by wards, however that might be. We could look to set up your locations. And then we were able to pull through things such as the number of maternity incidents and all of these things, as you'd expect with analytics. You know, we've got extra insights, there's information, you can put tooltips, you can expand, you can drill into. But on this high level dashboard, we've pulled through number of incidents. We wanted to look at the injuries through instrumental delivery, number of C-sections. So we were able to have that very high level view of what's going on across the service. We're then able to correlate that against our audit data, so we can start to pull in not just a maternity audit data set, but actually say that we want to know what's going on with hand hygiene or PPE or the resus trolley or whatever that might be, and pull through all those different audit scores. You can then start to look at the incidents, not just by location, but you can look by type, by ethnicity. You can pivot that data in whatever way that you might want to be able to see and create this standard view. And then further drill downs that you might want on a standard view to be able to say, well, actually, show me types by ethnicity, so you can see where you want to start to drill further into that information. You can look at the trends associated with an event, so you can map that out and you can analyse it. And you can also look at action plans and look at those in detail as to what actions have taken place and what the descriptions around those actions were at that time. And then this is where we start to bring in and look at third-party data. So we can say, actually, I want to track my capacity at the same time and see what was going on across my maternity services in terms of capacity. I want to look at what my staff absence rates were, my wellbeing stats. I might bring in my agency usage. I might consider bringing in things such as service user feedback, staff feedback, friends and family feedback, everything that you need to be able to get that entire view of how that service is running from a really high level. Again, we started to pull through some of the financial stats, looking at the estimated liability by claims and the what that looks like per quarter. The kind of this example is just to show the breadth and scale of data that we can start to pull together to be able to look into these dashboards. As with all the dashboards, then you've always got the option to be able to export it, whether that's Excel, CSV, you can download it as images, or you can have a PDF that you design and you can download and save and send that as relevant to the relevant people. You always have at any point this slicer or filter down the right-hand side. This is whether you're in your own dashboards or general analytics. So you can further interrogate the data based on these different filter types at any given point. And then this is my favourite bit of all of Radar out of everything, and there's lots that I love, but specifically I like the pulse functionality, because not only can you start to look at your data sets in these custom dashboards that you built, but then you've got the ability per individual user to say, I'm just really, really worried about these 2 or 3 things and I want to set pulse watchers on them. For example, if there are any more instances of C-sections in this location, I need you to notify me immediately. Or if there are any more claims of this type, I want to know immediately so I can jump on it. And so you can create your own pulse dashboard of the things that you personally are really, really interested in looking at, and you can make that your default. So you've always got, as well as all the custom views that you've got your ability to have that pulse on the real things, to be able to dig out really quickly what it is you want to look at without having to go and search for it. It's worth also noting, just in terms of the types of fields that you can have within analytics, I think there's something like, and again, Damian, you can correct me when I get my numbers right, but I think it's something like 36 different widget types available to be able to create and design these different visualizations of data, because everyone has a different preference. Obviously, we have experts that could guide you or recommend the standard practice for visualization, but you know, there's all these different widgets and things that you can do to be able to do that.
Okay.
Yeah, just to comment on that.
Yeah, go, Damian.
So in terms of the actual visualizations, I think there's everything that you could think of in terms of out of the box, pie charts, bar charts, line charts, all the way through histograms, etc. But then you've also got the element, the custom infographics that Rhian mentioned previously, which is essentially an interface called blocks, where you can pull through HTML and JSON files and then reproduce any kind of graphic that you'd like. So recently we've been looking into sort of sentiment analytics, where we can demonstrate sort of like an NPC style graph where we've got like the happy faces, and it moves along determining on the positive and negative interactions that you've had in the incident. So there's lots of things you can do. You could have like a star infographic, for example. And just to touch on some of the dashboard designs that we've seen before, some of the actual widgets as well, you can use to interface into a drill down dashboard. So we had sort of like the audit pieces earlier with hand hygiene. If you were to select on that, it could offer some further insight. So you could have like the trend line graph for the score over time, and then any action plans that have been referenced against that. So there's loads of different things that you are able to do. And then just touching on the pulse, which Rhian mentioned, you can obviously select your key KPIs that you want to monitor across the analytics interface. But additionally, you can set up anomaly detection within that. So you can have it to flag at certain thresholds if there's certain KPI measures that you want to look at. But also, if you want it to identify anomalies that sit outside of an SPC, then it will instantly flag you, and that could be a text if you really wanted it directly to yourself, or an email, or obviously as a radar alert.
Thanks, Damian.
Great, thank you very much. Can I go back to some questions, Rhian?
Can I just make two final points and then I'll jump back? I just want to show this dashboard, and I've got examples. I can send everyone of these dashboards, but this is an example of an ICB wide view of safety and quality, and as Damian's mentioning, the ability to jump to other dashboards from that, so you can create this very high level view across a whole estate or a whole area. And this example is how we would see used for perhaps commissioner reports or regulator reports, or even if it's just your organisation reports from corporate drilled right through. I'll end there, Jill, and go back to questions.
Great,
Okay.
no, but thank you for showing those, because it really brought it to life. And I think it links with a question here from a manager at Brookdale, who says that they're new to radar and needs a simple way to analyse data, for example, quality assurance questionnaires from families, etc., complaints, compliments, incidents. And wants to know, is there a simple way of doing this? The data analysis tool I have come across looks incredibly long-winded and complicated. Now, clearly what we've seen here with the dashboard, it looks simple, but I think part of the question must be, to get to that point, how much work has there been? How complicated has it been to get to that nice, clear dashboard? So, Rhian, you've got your hand up.
Yeah, I'll take that one if that's all right, because I think we're referring to two different things. So when I showed on the wireframe that we have the query report builder, I think you're probably referring to report builder. And what I'm going to do is arrange for a call afterwards so we can show you the analytics and how we can set that up so you can really quickly get to your data, rather than having to do what would be the old kind of report interrogations into the system. I think that answers the question, but I will write to you to make sure we get that in proper depth.
Right, no, thanks. That's a really, really good offer. Another question from someone who says they're new to radar, Keith Hawley. He says he's used all the other standardized systems. At the organisation I'm currently with, they have a category of generic incident, which covers a multitude of incident types. And I understand that this cannot be changed. What's the workaround that others have used to get around this? So going from generic, I'm assuming, to more specific, more detailed information. Does anybody wish to answer that? Great, you've put your hand up, Andy.
Yeah, I can take that. So we had a very similar issue with our previous system where we had a category that covered other, which, if in doubt, everybody used. So that was sort of the generic category, incident category used by most people for most incidents. So what Radar has within it is the ability to create a list of categories as long as you pretty much like. So as long as your organisation are happy to customize their forms or the way they record their incidents, you can categorize them in you know, any which way you want. So we've got a very restricted list of categories. Other is now no longer on there. So we have eliminated that sort of generic approach to incident reporting and asked our users to make sure that they select a specific category. And going back to the training example, that's probably the one bit of training that we did have to focus on, is making our staff aware of what the incident is and what category it might fall under, because some of those are a little bit broader than others.
Any other comments on that bit of question about generic incidents? If not, I'll pick up probably a related point from Lauren Spinks, who is asking about end users and whether they're logging in to provide the data firsthand, or if the data is being recorded by some sort of third party. And again, asking about ensuring that the data is accurate, that the information is accurate, that the events and investigations are all recorded. That might be the same answer we had before, but just double checking, Andy.
Yeah, so it is firsthand from our nurses and staff on the ground. So they report straight into the system. There's no third party involved, or managers doing it on behalf of staff. The investigations are done by the line managers of those teams, so the ward managers, or if it's a more significant incident, then it will go up to the clinical managers of those areas. So the investigations are done retrospectively, obviously, within the system, but that's working with the teams that have reported it. So the user that's reported it reports their details on the system, and that we're quite a small organisation, so we have the ability to be able to work hand in hand with our staff on the floor, with our line managers. So we have the benefit of being able to do that. It might not be so easy in a larger organisation, but what it does do is allow for conversations to be had around things that have happened.
Thanks. And Rhian, presumably there are different models in larger organisations, or other than the data going straight in. How does it work in other places?
Yeah, absolutely. We've got a kind of three-pronged approach for data input. One is it coming in via a form within the radar system, and that's the kind of traditional method as you'd expect, where you're logged on and you're able to input that information through your own log-on details. The second is the way that Andy's referring to it, and that's the ability to import data from external forms that are hosted externally. An example we always give, and I don't know if we have our customers here today from Alzheimer's Society, but if you go on their website and you look at their feedback form, that's actually a radar form housed in their website. It just looks like it's their website, not radar, but that auto brings data into radar. And then the third way is via our API in the example we described briefly earlier. But we have data being fed into radar from Cerner, the care planning system. So we're live with Nourish. So if an instance logged in Nourish, it's able to auto link into radar and come in from that way. So we run those three methodologies concurrently. And like you say, Jill, every different use case is different, and organisations will run a mixed economy as well.
So based on what you've just said, I'm assuming the answer to a question from Nadia Morris is yes, but the question is, are there any existing integrations with radar and other third-party technology solutions, i.e. nurse call systems, falls detection tech, etc.?
Yeah, I'll take that again if that's all right, Damian and Andy,
Yeah.
just because that sits in my world around the partner integration. So our API methodology is for any willing provider. So anybody who wants to integrate with radar can. We have a toolkit that we will give out and a kind of way of setting up a partnership and working with them. So in theory, anybody can integrate with us. The actual list of our partners we can share with you afterwards, but we have use case examples from care planning systems, EPR systems. We have devices, so fridge monitors sat in fridges, and if the temperature drops, it auto links into radar and would set off a alert within and a workflow within the radar system. It's as vast as it is wide. We also not just have that integration for data input, but also to be able to look at data. So we work with workforce planning and rostering systems, we work with HR systems, with feedback and wellbeing systems, with other quality improvement tools to be able to look at the data at an organisation or high level via analytics. I think you're on mute, Jill.
Sorry, my screen had a mind of its own just then. There's another question along the same line of linking data sets, and it's from Rosemary Winfield, who says, I am creating tracker databases in Excel. One is for tracking QA issues and resolutions, and the other is to assess if client hours are delivered and ascertain the surplus or deficit. Is that something that could be created into Radar instead and analysed in Radar, or is there a way to link Excel data to Radar? I'm sure we can link it, can't we? Is that? But sort of these questions about linkage, if we can just sort of expand on that, because it's great to see that different systems can link in an ideal world, or indeed in a future state. Would you expect people to gradually migrate that data directly to Radar, or does that make no difference?
Go on, Rhian, if you want to speak.
Well, I was going to say there's two parts to the question, isn't there? There's a technical answer which Damian can give, and there's the theoretical answer. I don't know which you want first. Shall I place it, Damian, and then you can go and give the detail? Mm-hmm. So our firm belief at Radar is that we will always be an interoperable system, because there's no such thing as this kind of one size fits all, and trying to have a monopoly of a system across all these different facets of health and social care has proven over a vast number of years that it doesn't work. So the best approach in our view is firmly to have an interoperable system, and that's why we've invested so much in this API integrator and in the ability to pull data in or out. And to answer the kind of broad question, it's about what's right for the organisation. So in the future, we will get to a point, and our aim very, very quickly is to be able to sit down with organisations at the point of purchasing a system and say, right, what is your data strategy? Where do you want your data to come from? Where is it best housed? What do you want in your data warehouse? What do you want within Radar? How would you like the data to come in? And map that data strategy up front to start to have that view of how it will be used moving forward, which is something that all providers kind of are aiming to do, but I think that we've got a bit of a vanguard on it with having this API adapter. But I'll let you give more detail, Damian.
Yeah, so I think in terms of sort of the actual question, I always find it funny that people find new and wonderful ways to use Radar in terms of like how to use the events forms and the workflow engine that sits underneath that. But it's looking at the actual proposed sort of problem, you could definitely raise that directly through Radar and surface the information in analytics and do the calculations that way. But alternatively, if you have a custom analytics cube, you're able to include sort of any kind of integration into there. So Excel is one of those. We could do that definitely.
Okay, thank you. Got some more questions coming in from Regina Locke. Is there a way to report the status of each individual form rather than the workflow status, including directorate, specialty, who is assigned to, etc.? Who would like to answer that one? I'm not sure if that's a technical one or one for you, Rhian. So it's reporting status of the individual form. You can't answer that. No.
Can you, Damian, or do we need to go away? Regina can come back to you if Damian can't.
I'm just rereading the question. Is there a way to report status each individual?
It might. It might need following with. Yeah.
Yeah. So it can be done both. There's different hierarchies based on the data sets. So we do have different dashboards to represent the different sort of levels of data. So we do have sort of an incident management dashboard that covers the sort of high level event, but then we have a workflow dashboard that can drill down into more granular levels of detail to identify any roadblocks in that particular workflow, and also who has been assigned to that. But all of the data can also be broken up through each entity that's included in the form. We also have baseline figures such as the locations and regions, and we have something called tags, which I'll include in here, as a lot of our customers use these as specialities or like clinical divisions. So you can essentially include any locations with an additional classification with the tag, but also an event type as well. So if you had a fall, but it was also a safeguarding issue, you could tag that with a safeguarding, and you could surface your safeguardings separately in an individual dashboard, but also you could then break it down by different regions and divisions.
Great, thank you for that answer. And hopefully everybody's getting an impression that Radar is a very flexible system, both in terms of where the data comes from and gets into the system, and then how it's analysed and displayed. And I think that's one of its key strengths. But linking with that is an important question we have about money. So I need to ask the money question. I can't see because it's not displaying very well on my screen. I think it's from Lauren Spinks again. And the question is everything charged individually on top of the annual charges? I.e., would the setup and ongoing hosting of a feedback form on a website be an additional charge? It's up for you, Rhian.
Yeah, and the answer is it depends. It depends what's in your contract. So some contracts, everything's built in up front. Other contracts, it's piecemeal. So I can pick that up with you separately and look. But yeah, it just depends on how things are built in the contract. Most contracts, but generally speaking, will have analytics in them, or the newer contracts definitely would have analytics. The custom builder and the ability to build your own kind of dashboards and things usually is an extra part to the license fee.
Okay,
do you like to
thank
see
you.
a hand up from Rhian?
Okay, would you like to come in?
I don't know if we have the audio.
No, we probably don't. No, perhaps any input could be added to the Q&A, if it's possible to do that. I'm going to go back to a question that's come in from Paul Chandrasekar. How can we extract the data in Radar to include in our Power BI reporting? Is that for you, Damian?
Yeah, I can take that. So we offer a clone service, so we can clone the database that we have, and then put in any kind of repository that you request for. So yeah, I think there's some commercials around that, but it's a solution we can offer.
Great. Okay, we're getting through most of the questions, which is good because we are coming towards the end of the hour. But I'll just add a couple more, if that's all right, Rhian, before we get to your final session.
Yeah, lovely. Yeah. Thanks, Jill.
A question from Sue Klein. Does the API surface all data from forms?
Yes.
Yes. Okay.
Based upon, but yes, there's the design up front of what you've got coming into the system. So it depends on the data and how it's linked into a form in Radar for the input, and then how you pull it out into the custom cubes or into your BI warehouse. Yes, it pulls all those different elements of data.
Mm-hmm. Just because there's been such a range of questions, and we've covered such a lot of sort of technical bits and important questions around what we can do with the data. In practice, how does it work if somebody is thinking about using Radar for their trust or healthcare, for social care facility? Where do you start having the conversations about what have you got already and how might it look in future? Because that's clearly an important part of taking it forward, isn't it? Is having that conversation around what it's going to mean for you as an organisation.
Yeah, absolutely. And it probably ties into the last bit I wanted to talk about, is a bit about the business case around it. But one of the key things to do really is to sit down with your customer service manager, and we can arrange that for anyone that's interested, and start to look at that map of actually what is that data kind of map, that where do you want your data to come in from, where do you want it to go out to, and what kind of dashboard would you like to see? Because as with anything, it's kind of really good for us to sit here today and present the art of the possible and talk about all these exciting things that you can do. But I think it's about putting it into a much more palatable, condensable plan and a step-by-step plan. So where we see the most success, and Damian has much more experience of this than me, but it's about picking a subject perhaps to start with and say, right, I want to look at my complaints. So this is the dashboard I'd like to see for complaints. This is how I would like to use complaints, and do my forms correlate that? And am I getting all my data from the relevant places? And am I getting it out from the relevant places? And what do I want to see? So almost dealing with things subject matter rather than kind of as an entirety, because otherwise you can kind of get really bogged down. Damian, Andy, you're nodding. Have you got anything to add to that? Are you just telling me I'm right, which I like?
So I was just going to say, yeah, it's just important to get key stakeholders in a room from that particular environment that you're trying to ascertain, and understand what is an actionable insight for them, and take away their sort of high level KPIs, and then see what you can reproduce in the analytics, and then design the form from the final outcome that you want. So work backwards, find out exactly what the actionable insights are, and then try and surface those through the forms.
Absolutely agree. It's working backwards, and with this, sometimes it doesn't make sense, but obviously in this case, it absolutely makes sense. We've had to go back to forms. Now we've had analytics running for a while to tweak them to then enable us to have the data. So knowing what you want on your dashboards and in your analytics really helps you build the front end of the system.
No, that's great to have that confirmed, and that thinking sounds to me a really crucial part of the whole process, because if you don't get it right at the beginning, you won't get it right when you're trying to use it, will you? So I think that's a good point to let you talk about the business case, Rhian, if that's okay.
Yeah, absolutely. Liv, will you just press the next slide for me? It's just to talk through, if you're thinking about this in terms of how you make a business case for it, or if you're wanting to use Custom Builder, we've got some tools we can send you, but really it's thinking about it from these kind of different elements. One is the very obvious improvement of patient and resident outcomes, and we've got tools that can help kind of design that and explain how that might look. The fact that you can have investor or board assurance through your organisational wide dashboard. So that, you know, again, our auspicious aim as an organisation is every board in the country should be able to know instantly where the risk is, where the hotspots of risk are, what's being done about it, and how quickly it's being acted upon, and what lessons were learned. And that can be done through having these configured dashboards. There's commercial benefits, and I know for our NHS trust organisations that's a slightly nuanced approach, but it just considering it from the point of view as having commissioner reports. So for private organisations, that gives you a real competitive edge to be able to have that commissioner report to go to commissioners and say, this is how well led I am, this is how well run I am, all those kind of Chloes. Again, for the different payer groups, publishing quality account dashboards. From the background I come from, I've seen that kind of manual process that people spending months and days and weeks correlating all that data, and then imagine just being able to have that as a dashboard. There's the regulatory efficiency through, you know, having your CQC, your regulated dashboards. We speak or are speaking to the CQC to see if there's a way via our methodologies that we could automatically present that information to them from your dashboards. That doesn't exist at the minute, but that's certainly where we'd want to go, and hope CQC would see the benefits of doing that. Then there's a kind of really basic operational efficiencies of just going from manual data collection and reporting and screenshotting and looking at 20 different spreadsheets. Again, Andy, I can see you smiling, like being able to pull all that together and have that at the touch of a button. And then, you know, there's the longer term strategic effectiveness from having that oversight and knowing where your risk hotspots are. Liv, have I got another slide just to show some of the tools that we've got available? Yeah, so we can send all this out for anyone who's interested, but we've got an example business case. We've got a bit of a make or buy tool that kind of helps you just think through the benefit of, is it a radar tool or is it something that you can just build in-house, and it kind of takes you through that decision making. We've got an information sheet that we can send you, and if you do want quotations, let us know and we can get in touch and give you more detail. We also will get in touch with the really specific questions that people have asked to make sure that you've got proper answers. Okay, thanks, Jill. Back on mute.
Thank you. I did click the button. It's not being responsive today. Great to have those final words, Rhian, and particularly the offer for more information, because we've only had an hour and there's clearly an awful lot to cover. But I think we have had an excellent introduction to Radar Healthcare and what it can do. It's excellent to hear from Andy in terms of his personal experience of using it. But I would say that flexibility of the system is clearly the big factor that I would take away. It's plenty of scope for it to deliver what you particularly need in your own environment. So thank you to everyone who's joined. Thank you for your questions. Thanks to Damian, Andy and Rhian, and anyone else who's been organising this in the background. So we've had some fantastic questions, and do follow up with the team and they will, I'm sure, be liaising with you as required. So thank you very much, everyone.